and that's the whole idea of pot smokers are fat and they just sit around, like that's just no longer.
Do we look fat to you?
Yeah, exactly. That's what I'm saying. Right? Don't call me fat. Right?
You mean PHAT?
Exactly. No, it's
That's
so
my
true
whole thing.
though.
My whole battle right now is showing what successful stoners look like and how can you. I took. Do you know Dr. Sulak? He's like a medical cannabis expert. I took his program online, which is all about microdosing and properly dosing.
What's his name?
John Sulak, I think his name is.
In Maine?
I don't know where he's from. I just took his online course
Oh,
and
okay.
follow his stuff. I'll pull his stuff up. He's brilliant.
What am I thinking? I'm thinking of. Sulak.
Sulak.
Yeah, Sulak. Yeah.
Is it Sulak? I've been saying Sulak this whole time.
Yeah,
Sulak.
Yeah. No, he's awesome.
He's amazing. So yeah, my whole thing has been about teaching people like, listen, I can get stoned at night, no problem. But when you learn how to dose it correctly, because I took myself off of antidepressants completely and switched myself to just cannabis. So it's like.
And you're on mostly. I assume you guys all are on like CBD dominant stuff, right?
Yes, totally. And then I microdose. I'll microdose. I think like between 2.5 and 5 milligrams of THC every like 6 hours.
5 milligrams of THC every 6 hours.
Yeah, it just.
I mean, I guess your body just gets used to it. You get tolerant.
It just gets me to a point where I'm like, I don't feel stoned. I just feel at like the very best of myself. And
so what does the CBD do completely by itself?
I just take mine.
So if you looked at that and didn't add in your THC, what would you get? And then when you add in the THC, what do you see?
If I say that again.
So you just do your product.
Uh-huh.
Where does it take you? And then when you add your 2.5 to 5 milligrams of THC, where does that take you?
So if I just take just CBD, I just feel relaxed and not as on edge.
Okay.
When I add that 2.5 to 5 milligrams, I am just a happier human.
Yeah, that's what I think THC does.
Dopamine.
Yeah.
Serotonin.
I know. No, I do. I mean, you see it in patients. I'm a marijuana proponent. I know. Most of my patients are on pretty high amounts of THC. So, not that I'm against hemp products. I think that they have
no, but you're doing it for mostly cancer.
Yeah.
That's what I tell everybody. Like vet CBD, people show me they have 20 to 1s and stuff. I'm like, that's awesome for cancer. They don't need that for anxiety and seizures as much.
Vet CBD?
Yeah, vet CBD.
That product?
Yeah.
Oh, I don't use it for cancer.
Well, I'm just saying it has more THC, so for like a normal person.
Very little.
But more than what you can get federally anywhere else.
Of course. Well, because it's a marijuana product.
Exactly.
Yeah. I mean, we're talking about a lot of my patients are on, God, they're on a lot. I have a dog that's like 18 kilograms maybe. 18 kilograms. So let's say, I think he's maybe around 40 pounds, and he's getting 30 milligrams of THC twice a day.
Wow. And does it get him super stoned?
Nope. Totally fine.
No.
Doesn't get him stoned?
Totally. I mean, I see him all the time. And you know what was crazy is he was so nervous coming into the vet.
Even in the first dose.
Oh yeah, it took me a year to get him to that dose.
Okay.
Oh, okay.
You slowly built
So
it.
I'm like I'm a conservative lady. I'm one of the most conservative oncologists that probably exist. It was interestingly, I was trained in the Northeast, right, in New York and Connecticut, and my mentor was very, very aggressive oncologist. So I was very aggressive during my residency. I was giving higher doses of chemo that most oncologists were giving. And it was fun. I love the power of it. I mean, and probably not so good for the ego, but really, I mean, it was great. I was like getting these tumors to melt away, but some of these animals were getting sick, and then I moved out here, and the way dogs respond to chemo here, we'll talk about cannabis in a second. The way they respond to chemo here is so different than they respond in the East Coast. So I'll give you an example. So carboplatin is a drug we use a lot for solid tumors. You give carboplatin over there, I could give huge doses and they did fine. Here, I'm having to reduce doses because they just don't tolerate it the same way. It's same product, guys. We're getting it from the same manufacturer. There's something about exactly. There's got to be something about the environment. So I've spoken to and I think when I look under a microscope, lymphoma looks different on the East Coast than the West Coast. No one's ever brought that up, but I think they look much more plasmacytoid here than they do look very round cell.
So why do you think that is?
I mean, there's got to be some sort of genetic variation. I don't know. I mean, but perhaps. So there's the cancer looks different, the response is different, and then the patient variability is very it's
Wow.
there's something to, so then I said, am I crazy? Like maybe I'm just making this. I mean, you kind of go, you think yourself like no one's else. There's never been publication about this, and so I started to ask some of the docs that worked over there as oncologists and here. And there's a few of them, 2 of them, that literally work within 5 miles of where I am here. And they have said the same thing. They're like, in New York, I dose really high. Here, I'm starting, in Christie, we start at 0.7 mg per meter square normally. That's like across the country. A lot of them, like I start at 0.5 or 0.6. I don't even dare go to 0.7 to start. And I mean, we would start so high. So it's so interesting to see that, which is why I wouldn't be surprised if the response to cannabis is different from the East Coast. I would just, and the response to cannabis with cancer, right, it could be different. Just like I'm seeing the response from chemo with cancer patients, different. You know, there's a difference. So I don't know. It's really, really fascinating. And so I give a lot of THC. I mean, Gary's the same. Gary and I are like, you know, we always say we're like partners in crime, right? Like we're gonna hit them hard. And we're big THC advocates, but I see the research with CBD, and I'm not anti-CBD. I think CBD is like is
there's
awesome.
A place for it.
And I think there's actually a place for it for cancer patients.
Absolutely.
And you see it. So you see it, and you guys use a product that's very little THC. You're seeing tumors go away. It's not the THC. It's the CBD. It's also, I think it's whatever you have in your products, it's the combination of those. I'm looking at you, and I don't know if I'm supposed to be looking at you. Just
honestly,
look.
it doesn't matter.
Okay.
Like, here is better.
Okay.
Here is better for
well,
everyone.
because I want to talk to all of you guys about
please,
this.
I love it.
But I think it's the specific compounds that you're exposing the cancer to. This is my theory, and I stand by it, and I haven't let go of this theory, which is I don't think it's the amount. So I'm gonna burst your bubble a little and say. So I keep asking you, how much are you giving? 37 million. You notice I keep asking you that, partly because I'm not completely convinced, and I might be wrong. But for cancer, anxiety might be different. Arthritis might be different.
Of course.
I think anxiety, you probably have to go higher, truly. Or, in my opinion, you just throw in some THC, and there you go. You don't need to give so much CBD. Because really, an owner just wants to see their dog quiet, and I can make them real quiet with THC, right? So, but perhaps you don't have to go from a financial standpoint. Certainly don't have to give as much CBD. I'm sorry, CBD is expensive, right? So you're giving good quality CBD. Perhaps you don't have to give as much if you just throw in a little THC.
Absolutely.
But we're talking about hemp, and it needs to be legal federally, and so I get why you got to go higher, right?
The day we can produce more THC, we will.
You're just gonna put a
But
few
I
drops
don't
in.
need to because I'm getting rid of. Okay, so
Tell me, and then I'll talk about.
we're in California, so I'm going to state this: our product, and maybe we won't put it up or not. We are a cannabis product. Our plants are cannabis that are very high in CBD and lower in THC.
So they're marijuana.
Marijuana.
Okay.
Cannabis, marijuana, and hemp are from the cannabis plant. If it's called marijuana, it has more THC and less CBD, and vice versa. So that's why I think the emulsification and the bioavailability is so important. That mine can be a smaller dose and get a lot more in than somebody that's doing more.
It's because of how you're doing it. Like
I am
getting
I'm getting static ataxia from 0.3% THC product. How is that possible? So I mean, it doesn't. How is that? Can't even. Everything I've learned, static ataxia is from THC, and I have little in there.
Because of your formulation.
Right.
That's why. And it's because it's nanoparticle.
Right. So that makes
you
a
didn't
huge,
have that,
right.
which is why I don't know if you need as much. Like, do you need as? I mean, for your seizure, you're like, I've tried. I had to get to 100, but I'm wondering because
But she was
it's absorbed.
18. So I believe she had so many deficiencies in her endocannabinoid system that when she was flooded, that they haven't felt pain. And I watched this dog go from complete dementia, stand in corners, make no eye contact, to looking up at us, looking at us, give us kisses.
With one dose?
Well, she told you I was giving her 100 milligrams a day.
Oh, it's the same dog. Okay.
To get her to stop having the grand mal seizures.
But she was so imbalanced. I think
So-
she just had to.
And she was on multiple prescription medications.
The other thing that
Had no hair. I'm sure she wasn't eating. She had no hair on her tail, no hair on her feet. All under here was black. Going blind, whatever. And I mean, we do it over and over and over again. I told you, I get the dogs when everything else has been tried and I have nothing else to lose. But
those are the big winners, though, right? Like,
but I've watched my own dog where I did a maintenance. He had an issue. I did it for 2 months. The problem went away, and now I don't give it to him every single day.
you use it as needed.
As needed. But then there's other dogs who are sick, who are prone to seizures or prone to disease, or are trying to get rid of a cancer or something like that, and then I'm going to give them a lot more. And then I'm probably always going to keep them on a maintenance plan.
Well,
But
it's
of course,
that
I'm going
dog
to change the
on-
diet.
Yeah.
I'm going to change the diet and
Yeah.
look at their gut and their pro and prebiotics and
That's
what
what
else
I
can
do.
we do naturally to support it. Because we have the belief, and what I was taught is that this medicine brings us to homeostasis. Now let's let the body heal
Of
itself.
course,
And how can we
absolutely.
support that?
Yeah, because the body didn't have enough reserve when you're giving them all this garbage, right? All the preservatives and toxins the liver is trying to really get rid of, right? When you give them garbagey food, in my opinion. And then a lot of these prescription medications are taxing on the liver. And I'm not saying cannabis isn't a little taxing on the liver, right? So we gotta free the body of some of these toxins. And so the other option is like, and something I'm thinking about is like, do you put a lot of these patients on glutathione or something like that at the same time as you're doing all of this regimen to really help the liver get rid of the toxins? You know, because I think cannabis, why do you have to use so much more in a patient that's on prescription? Because the liver is like so taxed already. So you've got, and even in human patients, if you talk to some of the cannabis physicians, like the MDs, they're like, at least some of the ones I've spoken to, they're like, I have to use higher doses when they're on a ton of prescriptions. It's hard to get through because you have to break the barrier. There's so much toxin in the body that I think you probably have to break through. And there's going to be a lot of competition on receptor levels and things like that. So I do think you have to go a little bit higher. So a lot of my patients are on, a lot of them are on chemo, a lot of them are on other substances that I think are really hard for the body, and there's probably a little bit of competition. That's why I try to get them off of some of that stuff, because it just allows the cannabis to do a little bit of an easier job. And I think you don't have to go as high if you can get them off of some of that other stuff.
Yeah, we do that, and we also work with other companies that are doing things holistically. Like Adored Beast Apothecary has a prebiotic,
Okay.
and they have 2 actual dog canine bacterias in this.
That's
It's
what
the
you were
first.
telling me. I remember
So,
that.
being able to support that naturally, the gut naturally, the endocannabinoid system naturally, do everything naturally, you're going to see a dog come back to life. And you're going to see their livers and kidneys be able to function appropriately, even at a geriatric stage if we're supporting that.
I mean, the hope, right? It's weird. It's like some patients just don't respond, right? They just don't,
Right.
right? I mean, and it's okay to say that. Like, what we do is to try to help as many patients as we can possibly help. We can't help them all.
No.
Right? We can't. I wish we could. We're not God, and I think that we just do the best we can. And I think the more education you have, the better you can implement your knowledge and help patients. I think that a lot of people, unfortunately, a lot of people come in and with really sick animals, and they're like, "Can you save them?" And I'm like, "We're in a place that's so bad. What my goal would be is to help them feel more comfortable during the end." And then there's other patients that I'm like, "I'm gonna do my very best to try to get you a lot longer than I would have just gotten you with just chemo alone, right?" And because you have a little bit more time. The body doesn't work and heal itself that quick. It takes time. Sometimes you don't have that time.
Right.
But it doesn't mean that cannabis, in my opinion, doesn't have a place. It could certainly have a place as long as it's a patient that doesn't have, profound severe heart disease, something like that, where I'm going to make them worse, right?
Because we know it's going to calm them. We
Sure,
know
yeah.
that they're not going to have pain or stress, because that's what it does for us. So I don't know about you, that's the way that I want it.
Yeah.
Can we just, this is
Sure.
great. I just want to get like a opener. So if we could do like an introduction.
So we're gonna start.
Yeah,
We'll just
let's
start.
start because we've got
That
all
was
this.
fun and great, and
Yeah.
now we'll start.
Yeah, cool.
Like what we started. That's okay. we find a purpose and somewhere for it all. So we did the same thing with Dr. Richter. We walked around, we chatted about all kinds
You
of
saw his
things.
hospital?
Got back.
Oh yeah.
Got back, and we have these awesome little gems to plug in.
We're not going to say anything from now on.
This is going to be podcast, so just me. I mean, you're welcome to look at the camera and keep aware that this is where we're talking into and getting our audio.
So you say isn't podcast just audio?
We do, but we record them,
Okay.
and we will. They'll live somewhere one day.
Okay.
Somewhere.
Okay.
For
So you don't
instance-
even get me in this?
No, this is video.
No, we're
This is all
video.
going to be on video.
Okay. Okay.
Because the goal would be, we have videotaped all of our podcasts we have it with Dr. Richter. We are looking at trying to create, well, Dr. Richter's created a My Pet Companion.
My Pet Thrives.
My Pet Thrives.
Mm-hmm.
I see these living on a resource like that.
Mm-hmm.
Because a lot of our podcasts, they're not just about cannabis. They are about all natural
Wellness.
healing and wellness.
Most of them aren't about cannabis.
Most of them,
are
matter of fact, I'm produced by the Cannabis Radio Network, so they get mad at me sometimes that I don't bring it up enough. But there's nothing better to talk to a vet who knows everything than at the very end for them to go, I love cannabis. I used it, I've been using it, I'm a big believer in it. Or they go, I would love to add cannabis to my toolkit. How do I, what do I? So I think they all go hand in hand.
Okay.
We can't just give you a tincture to put in your dog and he's going to be immediately better. It's a process. So that's our message, along with teaching people how, the system works and how it's safe and everything that you talk about. Good. So we'll start with that. Awesome. Hi, everybody. It's Angela Ardolino with It's a Dog's Life, and I'm thrilled to be with Dr. Trina Hazzah, who is a cannabis leading expert when it comes to our pets. She's an oncologist. She's been working with this incredible natural medicine that we know all about for a very long time now. And I am so excited to be here. I met you and first saw you and heard about you at the HVMA. And I always tell everybody this. I come from the cannabis. I'm in the pet industry. I'm in the rescue industry, if you could even call that. But I came from the cannabis world. And I kept going to pet industry events and hearing them talk about THC killing animals. It's dangerous. Stick with an isolate or a broad spectrum product. And of course, I went to school for this. You know better. My head would, oh no, this is the wrong information. And then I went to HVMA and heard you and Dr. Richter, and I was like, finally. I actually stood up and gave a standing ovation for Dr. Richter because I literally went in there scared that the wrong information was going to be given out again, because as we know, there are vets out there who have actually even put out products that, a broad spectrum product, as we know, may help with some anxiety and fear, but it's not going to help with disease or seizures and the big things that are life-threatening to our pets. So to me, it's kind of a disservice for a person to go in, trust us, they've listened to us, go buy a product that has very little actual cannabis medicine in it, and they don't see a result, and they're unhappy.
And they think no cannabis would work.
Doesn't work.
Right.
Or that they're so scared of the THC. So, and of course, one of the things I get most asked most often is that, well, if this is so great, why isn't my vet telling me about it? Or why is my vet telling me it's going to kill my dog? So that's why we're on this tour, not only to educate pet parents to take responsibility for their own pet's health, but to also talk to vets who have been using it, who are advocates, and you are one of the best. And thank you so much for being one of those people.
Thank you.
And thank you so much for letting us come into this beautiful hospital and interview you. I know you're extremely busy. So I want to know a little bit about you. I want everyone to know a little bit about you. Kind of your journey. When did you know that I want to be a vet, or I'm great with animals? And then tell me what you did from there, what you went to school, and then how did you discover this cannabis route that you went,
Well, how many hours do we have?
As long as you want.
Right. So I actually grew up in Washington, D.C. Very few people grow up in the city, right? So I grew up in Washington, D.C. I'm first generation American. Both my parents are from Cairo, Egypt.
Oh, neat.
And interestingly, they were really into animals, right? I say interestingly because we grew up as a Muslim family, and back in Egypt, the family really was not supportive of animals, right? In Egypt, in Cairo, there's dogs and cats running around the city, and they would say, don't touch them, they're dirty, right? And so, but my grandmother, my mother's mother, loved animals. And she, a devout Muslim, loved animals. She didn't listen to what anyone would say. She would bring the animals into her home. She would take care of them, and she loved tortoises. was like the best. So I'd go to her house. She'd have tortoises in her house.
Yay!
And I mean, but she didn't understand salmonella or any of this. They would be sitting on the kitchen table, right? Like, and she would name them Cairo, Alexandria, Mahdi, like all these different cities within Egypt, right? And it was amazing because I grew up having these little tortoises, and then she would, because I would go there in the summertime and spend time, and then she would say, why don't you take them back to the States with you? And I'm like, I don't know if I can. She said, just put them in your pocket. So, and I have an identical twin sister.
Oh, no way.
Yeah, I mean, we look very similar. We always joke. She says, I'm the smarter one, and we go through this a lot, right? But she is actually the largest lion conservationist in the world right now. She lives in Kenya. So we both got into animals. And part of this is my grandmother, right? Like, she's like, take them back with you. I'm like, what are you gonna, so we had these, I mean, we were very, very young, I don't know, 10 years old or something. We had these sweatshirts that had the pockets in the front, and we each put 2 tortoises in our sweatshirts, and we brought them back. We flew into Frankfurt, then we flew into the States, and with these turtles or tortoises, we fed them on the plane, like the little peas they'd give you, and then we put them back in. I mean, and so we brought these. I mean, can you even imagine?
No.
Like, yeah, now 9/11, that
Right.
never happened. I think I had little,
Right.
bombs in me. So, anyway, that's kind of how it started. I was like, oh my God, this is so much fun. My grandmother loves animals. I get to run around Egypt with her and play with animals and feed them. And my mother, her daughter, my mother, and she was very into animals as well. So she lives in Egypt now, and she's always sending me pictures. Do you think I can take this one off the street and keep it? And I mean, is this a nice breed for me? I'm like, Ma, it's like an Egyptian mutt. Just take the dog, right? Like it's, and so that, and then coming to being in the States, living and growing up here, my parents were very supportive of having animals, and we didn't have a ton, right? We had some. We had a cat and we had a dog that ran away, and then eventually came back, and then ran away again, and never came back. And then I begged. I wanted my own dog, and at 15, I finally got a yellow Labrador. It's all I wanted. After watching Old Yeller, I wanted a yellow Labrador, so I got to pick this yellow Labrador, and he was my best friend. I mean, he was my best friend until I was 31, and he passed away. So I had him for almost 16 years, and we did everything together. So I thought, my father, very kind of strict Arab father, said, you're going to be an orthopedic surgeon. I said, okay, well, and I was good at math and science, but I didn't realize I was actually going to be a doctor and then an orthopedic surgeon. And so I figured, I kind of go down the track, right? I'll go to college, and and then I was like, I have to pay for this dog. At 15, 16, I had to pay for this dog, and how was I going to do it? I started to have a dog walking company, my own, and then I started to work for a vet clinic, and I cleaned cages, and I was really good at cleaning the cages.
But what how awesome for you to go, okay, I need to make money, let me go do it and go do something I love.
Well, also I needed to pay for the dog, and the vet would give the dog free services, and she would do dentals, and she'd give me free food. So it was just the best. Like how did I get, and so cleaned our cages, and then finally one day she was like, hey, my tech called out. Can you come help me? And I was like, no, I just clean cages. Like I don't. She was like, Trina, just come help me with this. And then that day on, I was like her sidekick. I did her dentals, did her, helped in surgery, and loved every bit of it. And she was a Tuskegee graduate, and she introduced me to some other Tuskegee graduates, and she said, listen, you should go to Tuskegee. And I'm like, I am not moving to Alabama. I'm in Washington, D.C. And so I applied to a bunch of different vet schools, and Tuskegee accepted me right away, and I was on the whole list of some of these other institutions that were really expensive. And they're like $60,000, $45,000. I mean, and Tuskegee was like $18,000. I mean, it was just, and I said, okay, listen, I have all this support from Tuskegee grads. They have supported me through this entire way. Let me do this. So my dog, Otis, and I moved down to Alabama.
Wow.
We were there for 4 years, and that was just, it's a life-changing experience to be in Alabama. And so, at first I was terrified because I couldn't even understand the accents, right? I was just like, are they speaking a different language? But they are just such warm, loving, kind people. And I lived in the town of Tuskegee where there was absolutely nothing. But it was so nice because even the mail lady would come in, and I'd be getting dressed out for a banquet, and I'd be like, can you come in to tell me if these shoes look right? And she would, Trina, here, I got your glasses. I'm at the CVS. Here, I found your glasses. This is the type of town, right? It was so lovely coming from such a big city. So anyway, then decided to do an internship, and there was, in my mind, I had to go to the biggest and the best. So at that time, it was Red Bank in New Jersey, which was the largest veterinary hospital in the country at that time. So I went there, and it was nice to come back to the Northeast, and Otis came with me, and then I did a residency up in Connecticut, and so he came up there with me, and it was the right path for me, and I didn't know what I was going to specialize in. I really didn't. I just knew I didn't want to do a GP work, and partly because you had to be really, really smart to be a GP, and I didn't think I was that smart. I mean, it was just to know everything. I could just know one thing very well.
Right.
And so people say, God, you must be really smart to be an oncologist. I'm like, no, you gotta be really smart to be a GP, because I don't know anything about ears or skin or, and they have to know it all. They have to know cancer. They have to know. So for me, it was like I could focus at one thing, and I ended up spending time in Tennessee over the summer, and I elected to do some oncology work there, and the oncologists there were like, Trina, why don't you be an oncologist? Like, this is what you're really good at. And I was like, am I? Like, you should just do this. So they wrote me recommendations, and I ended up going on the way to be an oncologist. And then Otis passed away right the last year of my residency, but he was with me through that entire process. I mean, like, that's like a homie, right? Like, that can go through it all with me.
Mm-hmm.
Lived in Baltimore in the hood with me, lived in Tuskegee in the hood. I mean, really just that he protected me, right? Like, he was my angel. And then I got to think I just had this beautiful gift of getting this oncology residency and becoming an oncologist, and I enjoyed I really did. I loved oncology, and I still love it. It just started to get really hard to watch these patients get sick and not being able to do very much about it. Mm-hmm. The typical medications, the Zofrans, the Serenia, the anti-nausea, it's starting to get a little old, right? Like, and I could get only but so much grasp on the cancer, right? This feeling of, as I mentioned earlier, like God, right? I could just cure it all. It didn't exist. It was like a facade. It wasn't real, and I needed to do more. And I'm in LA, so I moved to LA right after my residency. I figured I would go the furthest away from snow, and so literally, my boss asked me, "Where are you going to go? Do you want to stay here?" And I sat there in Connecticut while it was snowing. No. And I said, I can't stay. He said, why? I said, I'm just too cold. I cannot do it. Like, I have Egyptian blood. I cannot do it. I need to go to warm. And so, yeah, you get it, right? Colombian, right?
Yeah, we're born and raised in Miami, so
you get it.
Yeah.
Like, I need sun. I need warmth. And so he said, well, where are you going to go? And at that moment, I said, I'm going to California. I'd never thought about it. And so then I said, shoot, I gotta go look for a job in California. So I did my search and figured, well, if you're going to go anywhere, I might as well come to LA and have the LA life. And this has been amazing. And I came to the largest hospital, right, west of the Mississippi. And it's always like big, right? Let's just see, because I wanted to have this platform to do whatever I could do, right? And I needed that support. And fortunately, this hospital has been a wonderful place and has been very, very supportive of my going into some integrative medicine. So being into practice for a while, I realized I got to change it up. And in LA, people were asking me questions. Well, I want to start this herb. And I was like, I don't know anything about herbs. Or what about food? And I was like, I don't know, just go upstairs. There's some prescription diets and there's bags and I don't know anything about it. And I was giving my own animals this stuff, right? I mean, I was a Western doctor through and through. And I didn't have any Eastern training because in vet school at the time, there was certainly none of that, right?
So when you're in vet school, how much training did you get in diet and nutrition?
Only by the large companies that produce bags of prescription diets. That's all I would say. I'm not going to mention any names in particular, but you know who they are.
Also, were you taught about the endocannabinoid system?
Of course not.
So I want the audiences to realize that most vets know nothing about diet and nutrition because they weren't taught, and they don't know anything about the endocannabinoid system because they weren't taught. So when you go to your vet and you bring this up and they don't know what you're talking about, or they're scared because they read something, understand it. Understand their innocence and where they're coming from. And even better, give them this video.
Yeah.
Introduce them to vets who have been using the medicine and who understand it. Because if a vet knows about diet and nutrition and the endocannabinoid system, that means they went out on their own and learned it. Or they know about Chinese herbs or acupuncture or chiropractic. All of this is a choice they make to to learn about everything that could possibly help your pet. And those are the vets we love.
Yeah,
and she's one of them.
Open vets, right? That are saying, hey, I don't know what's going to help, but if it's not going to hurt, why don't we try a combination of some of the stuff that has been shown? And if you really look through the research, there's a lot of research out there.
Research.
And to say, I think what happens is that we were taught in Western medicine, there's nothing out there research-wise and holistic, but that's not true. If you go through PubMed, some of these Chinese herbs have tons and tons and tons of published articles showing that it can have anti-cancer effect. And a lot of them are preclinical studies or in vitro studies, but
they also been using them for thousands and thousands of years for these
cannabis,
things.
right? Over
Like,
4,000
just like
years.
cannabis, 4,000
4,000
years,
Exactly. No,
Okay,
it's
so
true.
you got into Chinese herbs.
So then I asked this hospital, I said, hey, would you support me going to get a certification in Chinese herbal medicine? Clients are asking, I want to support that need. And they were very kind. I said,
that's awesome.
We'll support you doing it. And they've supported me having, as you guys saw, the slew of herbs and material for owners to read about herbal therapies. And then I started to get a little bit into some Western herbs and medicinal mushrooms. But I certainly I didn't go in to get certification. And you start to get us more interested, right? Because you start to learn I learned all about the Chinese herbal kind of philosophy and got my certification. And then I was like, but there's more, right? There's more. And when learning about Chinese herbal medicine, you learned about cannabis. And that particular plant, that is I looked at it and I said, oh my God, there's over 700 compounds. This is unlike any other plant I've ever read about. I need to investigate this. And then the studies.
That's what I thought. How does everybody not simply start reading and going, wait a minute?
There might be something.
There might be something.
But
if lavender does this, and this plant does all of of course it's possible. A plant already has proven that it can do all of these things. Yeah, I was the same way. I'm like, I don't understand. When I saw a seizure stop immediately, I'm like, it's inhumane to keep this medicine from anybody.
Agreed, especially when dosed properly, when the products are clean, all of these things. I think that's the big thing is that number one is don't judge your vet for not knowing because they don't know. They don't know, as you mentioned. Like that, I wanted to add
and like you said, you're a specialist, and what she said before, and we've learned vets have to learn about everything. So then bringing on diet, nutrition, cannabis, Chinese herbs, all these other things, it's a lot of responsibility, especially when you're just trying to keep up with everything that's coming in. With all the problems.
So I guess I would tell a pet parent to not judge your vet, be open-minded, be compassionate, because they are doing a lot and they are trying to keep up. And I think it's our job, people that have really gotten into it and really have a passion for cannabis, to teach them. And the vets that are open to learning, we are open to teaching.
Right.
And if your vet is really just so, unable, doesn't have the time or the interest, it's okay. They're really good at maybe whatever else they're doing, and we are here for you. I think that's the big thing, is that every vet in the country doesn't have to be on board, but if you are on board for your pet, we're here to help give information and make sure that you are picking the correct product, that you are picking safe products, that you have an idea of what safe even means in cannabis world, and that you feel that you have support, because doing this all by yourself and going to the local dispensary can be a really scary situation and a scary place to go. And there are a lot of people out here that care and want to help. I mean, I got into this because I love animals, as I mentioned. I think that medicine itself is unbelievably interesting, and I love the thought process through a lot of just working through the cases and the strategy behind it and all of that. But at the end of the day, it's your pet, right? It's your pet that we care about and that we want the best, right? And I think that there's so many options out there. That's the truth. There's options for everything. There's options for Western, there's options for Eastern. No one knows what is the perfect combination for your pet. At the end of the day, you're going to figure that out, but we're here to inform, right? I think as veterinarians, we're here to say, here are all the options. Yep. Let's talk about what's safe, what's not safe, and then at the end of the day, you figure out what's best for your kid.
Absolutely.
We can't do that. It's the same with my kid or your kid. I mean, our two-legged kids, right? We get all the information we can. It's no different than a two-legged and a four-legged. They're our kids, you guys, right? And I think that you're just going to get as much information as you can, and then at the end of the day, you're going to sit there and make a decision just like we do for our own self. But I think just knowing that there's support, because I just get so afraid when I see these clients come in and they are like, I just went to the local dispensary, they just gave me this stuff, and I was like, oh my God, don't use it. I'm so terrified, don't use it. Your dog or cat's in heart failure and you're about to use a THC strong product, and I'm going to put them in heart failure if you start this. So please don't do that. And it's really a shame that the veterinary medical boards cannot support that. Because, and I wish owners would come out and be like, hey, veterinary medical boards, we need these vets.
They don't even know that they have to do that.
And
you know,
starting an I think
they don't even know.
Yes.
And that's why we're doing what we're doing. They don't even know that it's an issue, that they are petrified that they're going to lose their license if they talk about it, because the fear has been so pushed upon everybody that this is an illegal, illicit drug.
Yes.
And not the healing oil and product that it is. So you've been using the medicine in your practice here at the hospital. What are some of the biggest successes you've seen? I still get amazed. You know, when people will send me pictures from our own products, and I'm like, 2 weeks that fell off?
Yes.
Or my latest, you know, because of course I'm getting better at using the medicine and using it from the inside and outside, and watching tumors explode and ooze and disappear, come detached from the spine. I've seen it all, and I'm still amazed. And I'm also amazed that people, you know, freak out when they see a tumor dying in front of their, you know, because it's a disgusting looking thing. But what are some of the wonderful things, or I would love to know one of your first times that you tried it and you were like, yes, I was right. You know?
I'm thinking probably all the way, God, years and years ago, there was a little dog named Hammer. He was a Jack Russell. And the owners came in and the dog had 3 cancers all at the same time, which is really, really unfortunate. Hammer had bad luck, right? Like came in, low-grade lymphoma, we call it indolent lymphoma, bladder cancer, TCC, which is transitional cell carcinoma, and then an oral squamous cell carcinoma that was fairly large. So gave them all the options, and they said, you know what, he's like our family. We're going to do what we can, but we want to make sure that we're really focused on his quality, which I think is most important.
It is most important, their quality of life, not the quality of your life, the quality of their life, and they're not feeling any pain, they're comfortable, they don't know what's happening, they don't know they have cancer.
You want to keep them feeling like that, right? And so we ended up removing this down to what we call down to microscopic. So there wasn't any obvious cancer cells there at that point, but there was some microscopic disease. The bladder cancer we removed down to microscopic as well. And then the lymphoma kind of just hung because it wasn't really aggressive. Out of all of the other 2 were worse. This owner decided to start a targeted therapy. So no chemo, just a therapy that target the mutation that was causing these tumors to go. Presumption. I mean, we don't know for sure it was going to work like that, but that's the way the drug is supposed to. So, but for those particular tumors, we don't have a ton of evidence to support it would work 100% or 80%, but we knew that there was some evidence it could work on those other tumor types. Not as much with lymphoma. The other 2 seemed to be a higher, and those were the more aggressive ones. So we did that for about 6 months, and it worked. Like, we kept everything at bay, and around the 6-month mark, 5-6 month mark, this started to get so large that it took up his entire face.
Wow.
So it grew from all the way up here, and it took over his eye, so he wasn't able to open his eye. He could only open the other eye, the contralateral eye. And bladder cancer was starting to get worse. Lymphoma was still static, which was wonderful. And he just started to feel dumpy. He just didn't feel very good. So the owners went over our options again. And one of the things we discussed was cannabis. The owners, at that time, we weren't really able to have that conversation, but as an integrative oncologist, I felt very strongly that if an owner wanted to talk about it, I was going to guide them through the process to make sure it was safe. Because at that time, there weren't very many products that existed. So owners were very interested, and I said, okay, let's just start a 1-to-1. This is what they were doing in human medicine for cancer. I didn't know very much. I'd done some reading, of course, and was very interested in it, but I didn't know. I mean, to this day, we still don't know exactly what ratios or whatever it may be for cancer, but let's do a 1-to-1. Well, this dog was maybe 15 pounds or 18 pounds, less than 20 pounds. He started 1 milligram of THC and 1 milligram of CBD. That's it.
Every day?
Twice a day. Once in the morning, once at night. Along with that targeted therapy, the owner felt that we hadn't completely failed the targeted therapy, wanted to keep going. And I said, okay, listen, maybe there's synergy. I have no idea, or additive effect. But we have no idea. Even to this day, we still don't know. So let's give it a shot. So supported them and talked with them through it. About 2-3 weeks later, the owner said, hey, I think his eye's starting to open a little bit more. I said, no way, really, and even with herbs, I went through the same process, guys. Like, learned all about it, so gung-ho, but still a little hesitant, right? Until I started to see it work, right? And so with cannabis, it was a very similar thing. So eyes getting smaller, okay, just keep watching. And I didn't know at that time what titration was about. I didn't know to increase the dose. I was like, look, it was working, just keep it.
Right.
So I didn't want the dog to be high, or I didn't know.
It's your
as
first
much.
time.
Yeah, exactly. It's a baby. So there's a baby doctor. And so I watched this process, and probably about a month in, he comes in, couldn't find the tumor.
This one, the one on the face.
Couldn't find the tumor. Like, it was taking up his entire face. Not only could he open up his eye, I opened up his mouth, and I saw maybe some redness in the back of his mouth. He didn't say the dog swallow. I mean, usually it's like they call and they're like, it's bleeding everywhere. I have no idea. I mean, the owners, phenomenal owners, tumor was not there. It just he must have swallowed part of the tumor, but so hammer was just, I always would say hammer time, and he'd run around, and he was happy, and he was doing them, and this is 1 milligram. So this goes back to my whole theory of it's not the amount,
right.
It's the compound that particular cancer needed. And that started my passion really into figuring out which cancers respond to which compounds, and can I genetically evaluate these tumors to figure out what mutations they have, or alterations, overexpressions, even looking at are these particular genes hyperactive, right? Are they silenced? So we can get a little bit more information of how do we properly target the cancer with cannabis. I think targeted therapy is phenomenal. It's personalized medicine. I think it's where the future really needs to go, and is actually going. But why can't cannabis be personalized? It should be. It should be for every patient, in my opinion, for everything, for anxiety, so that has been my goal for the last 5 years or so, is really trying to figure out how do we get this down. And it's gotten a little bit more intense just in the last probably few years, or a year really, where there's now companies out there looking at genetic profiling for tumors, because now I just need to figure out how do I match the compound. Because if I know that, say, ID1 is overexpressed in this particular cancer, then I'm going to use a CBD dominant product and hit it hard. Now, how hard, I don't know, right? Can I use 1 milligram and it might work? I'm thinking I could probably use a few milligrams if it's the right compound and get it to work. Part of it has to do with their own endocannabinoid system, as we discussed. If it's so dysregulated and unbalanced, I might need more just to balance their system a little bit, and then I can pull back. And there's this idea of potential reverse tolerance with CBD, meaning that I could start a little higher and I could actually go back. Where with THC, right, the opposite usually occurs, where you still have to keep going up, right? And so if I have a tumor that really needs a lot of CBD, maybe I don't even need to expose the dog to THC at all. So these clients that are so worried, or vets that are worried about THC, hey, I have something that is personalized for this particular patient and for the particular patient's tumor.
Right.
So it's looking at genetics on a level of the patient, which it certainly exists in human medicine. Now, there's companies out there that are looking at your own genetic endocannabinoid system, right? And so I certainly believe we have figured out the canine genome, the entire canine genome. Why could we not do the same and run test swabs, DNA swabs, 23andMe? 23, and they do these what are the genetic tests in dog? Like, your dog is a poodle, and I'm like, my dog's like a Doberman. What are you talking about, right? Like, they do these, right? It looks like a Doberman, but you're telling me it's an 80% poodle. I'm so confused, right? Those same tests should be able, in my opinion, should be able to be done for the endocannabinoid system. So now I know your dog's tumor genetics. I know your dog's endocannabinoid system genetics, and now I can put it together and say, you have a mutation in P450, which means you're not gonna metabolize
that.
this as well, this particular compound, because this is exclusively metabolized by the liver, so I'm going to have to increase or decrease the dose accordingly. So not only do I know what your tumor might need, I'm not saying definitively, I wish I could say definitively. One day I'm going to say definitively, hopefully, but then I also know what your body needs. And together, we then create personalized cannabinoid therapy for dogs and cats. Perhaps we do this before they even do it for people.
Right.
Which would be amazing.
Right.
I mean, I think they
So
should do it
what
for
you're-
people too, right?
What you're actually saying is to use cannabis as medicine.
Exactly.
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 On this dog, the Hammer,
Yeah.
did you make diet changes? Were there any other changes that you stayed on
I
everything?
don't even think so, because I wasn't even doing herbal medicine. Well, I was starting to do herbal medicine at that time. And when I say I was starting to do herbal medicine, when I started to do herbal medicine, I started to do nutritional medicine. I started to do kind of a whole holistic medicine, right? You can't really just do one. I mean, you end up doing the whole thing. So I'm not sure if I was even doing it. The dog was probably eating, I don't even know.
Right.
I cannot remember. There's a lot. I can tell you 90% of my patients now are on whole food diets.
Right.
But at that time, I don't know. Maybe he was. I don't know. But I can say
Well,
it works.
that's what's so amazing about it is that even without the other tools, you were able to get rid of this tumor. I mean, I find, I have so much fun now. I'm like, I want to see how fast I can get rid of this tumor. The first time I got rid of, the first dog that I saved was given up on, it's going to die any day, tumors everywhere, cancer, and all I started doing was 50 milligrams a day of full spectrum. And we saved the dog, and we went back to the vet, and they were like, what did you do? So
That's incredible.
now I told you I do topically and internally, is almost like a race to see how fast I can get a tumor to fall off. And I watch them from I can see them growing every day. You take pictures of them growing every day to it stops, it starts shrinking. Some papillomas, it actually looks like someone took a lighter or a flame to them. They start turning black and dying right in front of your eyes until they're completely gone, and you can't even tell it's there anymore.
Have you ever evaluated if you just gave it topically?
I did. I have.
And what do you think it could ever just work topically, or you really think?
Of course.
Okay.
I got rid of ones just topically, but when I did I told you it's a race.
Yeah.
When that first person who wrote me, who got rid of a tumor in 2 weeks.
Yeah.
She did internal and topically. So I went from just doing either topically or internal to doing both, and that's when I would have the most success.
Yeah.
Because they're getting it in both ways.
Do you think that malignant tumors certainly need both, where the benign could just take one, or not necessarily?
Yeah, I think it, absolutely that. Of course, if it's malignant, I want to go the whole punch and get from everywhere, including diet, probiotics, gut, get it all, so that we can know that we can get it. I don't know what that means. How much time we've gone so far?
Trina has to leave at noon.
Oh, that's why. Nobody told me that part. Okay, so
Can I ask you a question?
Absolutely.
Do you dose off a milligram per kilogram, or you just say, little dog, big dog, everyone's gonna get this amount?
I do it ailment and age.
I think it's smart.
If it's a geriatric dog with lots of problems, I go in strong and then pull back because I'm trying to stop seizures. I'm also, a lot of times I come off of too many prescription drugs. So I feel like I have to support, is pain going to come back? Is anxiety going to come back? What's going to happen? So I also try to support it that way. But I do go big and go small, because I know I've already been taught it's completely safe, and I know how it works and how it's absorbed, but I also know that every dog's different and every deficiency is different. But some of the things we're seeing now that I've had my product out for 2 years now, thanks to the Farm Bill, is I see people who, not only did we get rid of the tumors or whatever the disease was, they'll start taking it for tumors, and then we realize that the owner goes, I'm not getting up in the middle of the night to let my dog go pee. Could it be helping her Cushing's? Or, he used to drink constantly and he's not doing that, or now he's not biting his paws, or the rash on. So I feel like the more that they're taking, the more they get in their body, that it's filling those deficiencies, and it starts taking care of all of the problems.
Yeah.
And then when we start supporting the gut,
It's like
you have a new dog. I mean, I have dogs. I love seeing the old, even my most recent one, Daisy. She looked like a dead dog. And she does not look like a dead dog anymore. She runs with the pack. She barks. She can't hear anything. Actually, I think some of her hearing is coming back because she can hear someone bark outside. I know I have rheumatoid arthritis. That's how I found the medicine.
Okay.
That's what I take to treat myself. I get inflammation in my jawbone, which blocks off my hearing. So maybe that dog wasn't even deaf. She just had inflammation in her bones or ear or whatever, and now can hear again. So it's just, I've seen everything now. In the past 4 or 5 years, and I'm sure you have, there's nothing scarier than cancer.
No,
And
it's true.
you know, people are scared of THC, and THC is the cancer killer. It will kill that tumor. I mean, it's been proven in human medicine, and now it doesn't even take as much because, as we know, pets and dogs especially have so many more receptors than we do, so they're much more sensitive to the medicine. And if the medicine is pure and it's made correctly and it's bioavailable, a little bit will go a long way.
Yeah,
So I'm glad that you said that.
Right? Yeah.
So it's I think that is the most wonderful thing. So I love how you say how you want to see the future go, and that it really is, that it's targeted, that it's used more as a medicine. How do you think other vets can use it outside of oncology? Have you seen any of that? Stress, anxiety, fear, arthritis,
Absolutely.
seizures?
All of it.
You've seen it all work on all of it?
No, I have. I mean, a lot of times it's because owners are just picking it up and doing it themselves, and then they go into their vet and say, "Oh, I went off the medicine you gave me. How's so and so still doing well? Oh, I started this." And so I think that veterinarians that aren't maybe yet knowledgeable about it are starting to see there might be something. And as they start to get more comfortable and it starts to become very clear how to guide clients, because I think that it's easy to say, I just don't know, so I don't want to talk about it. But eventually they're going to be so bombarded by clients, and that's where as I was mentioning, Gary, myself, we're all here to really educate so veterinarians feel much more comfortable to say, hold on a second, let me hold your hand through this process because I learned a little bit about it, or what do we learn from each other?
Right, and we don't have to fear it.
We
did the scary part, and it's fine. No one's gonna die. No one's ever died from it.
No, and I mean, if it's a safe product and it's dosed properly, it really is fine. Like, what's the worst? I always say to people, because I do a lot of my patients are on a high THC product, and so I say, what's the worst happen? They look at the wall for an hour or so. I mean, really, right? What's the worst that my chemo can do? A lot worse, right? And so, and it doesn't mean I don't believe in the chemo.
Or even some of the prescription meds are much worse. When people start getting worried about liver enzymes being elevated because of it, well, are you looking at what the opioid is doing to them?
And some of these other, and you know, and I think that there's a place for everything. Perhaps we can use, and what I'm doing a lot in my practice is using cannabis to help balance some of those side effects with some of those Western medications like chemotherapy or targeted therapies or whatever they may be, where you're getting the GI side effects, you're getting the lethargy, you're getting some of these things where cannabis can certainly balance them and say, hey, wait, I'm going to cut a little bit of your nausea with that CBDA or CBD, or, you know, this pet has really severe lymphoma of their gut in IBD. What if I can help with some of that? We know in Crohn's patients in human medicine that THC and CBD can be helpful, and certainly some of these other cannabinoids at low levels can be very helpful. So again, it always goes back to the same, which is figuring out custom for that patient. Like, your dog has IBD and cancer. How do we create a product? And maybe it's not going to be one. Maybe it's going to be a combination of a hemp product with a marijuana product, because I can't, you know, maybe I can't get enough CBD in this marijuana product. I need a hemp product to put them together, or I find a marijuana product that has a lot of CBD. But being able to figure out,
we get an internal CBD product and an external THC product. Who knows? It'll be awesome to be able to use all of those.
I've tried external THC products. They don't work that well for me. I think if you look at least in human medicine, what we know is a THC
as a patch or salve or what it is.
Yeah. Okay. Okay. No,
literally, we're going to Las Vegas. There's the biggest dispensary there, and that's where I can find it. And I load up on it. I get 6 bottles of it, and we swear by it at my house for us.
Really?
Yeah. My boyfriend got his whole knee redone. He put it on there. He feels no. I mean, it's the
What's
greatest.
the product?
I don't even know the name.
Okay.
It's terrible packaging, everything, but it's
But
the
it's
most
great.
wonderful.
Yeah.
I'll send you
And
one.
it's CBD.
No, it's CBD. It's a 1-to-1.
Yeah, see, there you go. So I know.
But same thing where you know it's manufactured and the bioavailability is there because it works a million times better than
I
others.
feel like it's just.
And I've tried patches that worked really well too.
Really? Because it's so rare to find patches that work.
I'll send you Colorado. Colorado is where you find this stuff. I want to be able to tell our listeners how to follow you, how to find out more about you that are more interested in what you've done. Where should they go and find more out about you?
I have a website. It's drtrinahazzah.com. And you can find me there. I'm also at VCA West LA. If you have a pet that has cancer and want to talk about integrative health, including cannabinoid therapy, you can always come to me here if you're in the Los Angeles area. Otherwise,
if they're not, are they able to?
It's illegal to do telemedicine.
Okay,
and we just got something from the board the other day. This was like maybe a few months ago.
That'll be our next fight.
Yeah, no, I mean it's unfortunate because I'd love to be able to pick up the phone and talk to people on the phone and say, let me guide you in this way, even if you're in Florida or if you're in, and so that. But what I would do is go to the AHVMA. They have a really good holistic site there that you can then plug in where you live, and they have a bunch of holistic vets.
And also,
pop up, which is really nice.
I always suggest that, but I also like to suggest that all holistic vets are not created equal. So even when you do find 2 or 3, and then go visit them and talk to them. I always say if you walk in the office and you see toxic, bad products, or they're being pushed, diets are being pushed on you that are kibble, then that's probably not your choice. But go visit a couple and make a choice and see who's
best. It depends on how big
best.
the hospital is. Maybe those products are supporting the hospital financially, right? But then
just like they're supporting the vet schools financially.
Exactly. But it doesn't mean that the vet that's at that hospital isn't open-minded. So I agree with you. It's like you
didn't choose that food. The hospital chose the food. Got it.
So I think that's just an important thing to say is go meet the person, go meet the veterinarian, see if you guys get along. If you're on the same page, there's people that come in here and want to do really hardcore stuff, and I say, look, I'm not the best. I'm not the best. You want to go bone marrow transplants and do I'm not your girl. You want to do. I'm open to really a combination of Eastern and Western. But the really hardcore stuff, there's got to be someone out there that can really hold your hand through that process. And so really finding someone that's on the same page as you is super duper important.
Awesome.
Thank you so much. Guys. We had just a problem. Will you just tell us where to find you one more time? Do you think that's it?
I think that we got that actually.
Let's get it just in case.
Sure.
Let's just find.
So where you can find me is drtrinahazzah.com, and it's DR. So drtrinahazzah.com.
That's
good. Awesome.
Thank you.
We're going to change real quick
Yeah.
and then ask you some fun questions really quick. It'll just be you answering if that's okay.
Awesome. Totally fine.
Yay!
Thank you.
You want to do any with that?
It's 11:50. You gotta go.
Well, like we can do 5 minutes.